Breast cancer have seen few revolutions in the last 10 years. One of it is the revolution in the treatment of hormone-positive breast cancer. For long years, we had only few type of drugs which we used to treat our patients with, and sooner or later patients will develop resistance. Nowadays, we have combination of therapy, which includes hormonal therapy and biological therapy, which have made the progression-free survival, i.e. patients living without progression of disease, longer, significantly longer, with a very reasonable quality of life, which is a very good news for our patient. This applies to the first-line therapy and to the second-line therapy. In the first-line therapy, nowadays it's the standard of care to use one of the hormonal therapy, whether tamoxifen or aromatase inhibitors, or even fulvestrant, which is an estrogen degraders, with CD4/6 check inhibitors as a first line. There was a significant improvement in progression-free survival for such patients. For patients who did not have the chance to have this in the first line, which they are not few, there are too many patients, they are already on single hormonal therapy, we can offer them the addition of CD4/6 check inhibitors as a second line. Also, there is the story of mTOR inhibition, which actually preceded the story of CD4 check inhibitors. Adding mTOR inhibition to hormonal therapy have shown to be very good in improvement in PFS at the second line. So maybe now we are shifting mTOR inhibition to a third line. The new medication have opened new hope for patients, but I think it also opened a lot of unanswered questions for us as treating physicians.